Well, senior care experts are sounding the alarm in response to a Spotlight on Maryland investigation about an underground network of unlicensed assisted living facilities. Patrick Huff has the latest on what action Maryland officials may be taking to address what some lawmakers describe as senior trafficking.
It's a public health crisis.
And many people will, be harmed or will die prematurely.
We're supposedly one of the richer states in the union, and we can't take care of our seniors.
Spotlight on Maryland launched an investigative series last month on how more than 115 properties in Baltimore City may be housing elderly residents without following state government regulations, resulting in dangerous living conditions and inadequate care for some of the city's most vulnerable citizens. We talked to 3 experts who warn the crisis will only get worse if Maryland officials refuse to take action.
Unfortunately, I foresee even more people being forced into choosing someplace that's unlicensed because they don't have any other options.
That's Susie Elder Murphy, the director of case management at the Silver Spring-based Aging Well Elder Care, which provides senior case management in the Washington, D.C. metro area. Kevin Hefner, the president and CEO of the Columbia-based Lifespan Network, seconded Murphy's concern.
If someone makes a medication mistake, sometimes people die. And so that's what's at stake.
Hefner's organization represents more than 250 senior care provider organizations in Maryland. He said unlicensed facilities are taking advantage of a rapidly growing senior population in the state.
The older adult population that's being served in the broader senior care landscape is more frail and has more complex medical issues than at any point in the past.
Ann Montgomery is a senior long-term care policy expert at the National Committee to Preserve Social Security and Medicare in Washington, D.C. She said the first step for Maryland officials to address the senior housing crisis is to ensure they have thorough data to act on.
We ought to look at cost report data and see where the money's going. So when you look at those 4 things, staffing, ownership, the safety record, and the cost report analysis, if you can do that, you really can see who the bad actors are and who the good actors are. And yet we are not really doing that.
Last month, Spotlight on Maryland interviewed Dr. Meg Sullivan, the Deputy Secretary for Public Health Services at the Maryland Department of Health. Sullivan was unable to say how many unlicensed facilities are operating in Maryland or how many employees the department has working to inspect senior facilities.
I don't have that exact number with me right now.
In a follow-up response to Spotlight on Maryland a week later, the department said it employs more than 170 surveyors, overseeing more than 40 programs, including those that address complaints about unlicensed facilities. When Spotlight on Maryland launched a senior housing series in November, the Office of Healthcare Quality had only issued 1 referral for prosecution to shut down an unlicensed senior facility, despite receiving hundreds of complaints since October 2023. 5 days after the investigative report, the office issued a second criminal referral to Maryland Attorney General Anthony Brown, marking the first referral of the year. There have been 0 prosecutions since 2023. Hefner said prosecution is an important start for reform, which must also include expanding staff that monitor and identify potentially abusive senior facilities.
There aren't enough people to survey to ensure quality in licensed facilities, which we represent, much less the ones who are unlicensed that you have to follow up on complaints and go after in order to shut them down or to enforce existing regulations.
Another solution proposed by experts is addressing a backlog in Maryland applicants for the Medicaid Long-Term Services and Supports Program, which covers housing and assistance for seniors in need of medical and financial support.
Literally nobody knows how many of those people are even still alive, let alone still needing a slot.
Spotlight on Maryland asked MDH to provide updated information about how many pending applicants it has for Medicaid long-term services. The department did not provide any data. Montgomery said one solution to this backlog is to allocate Medicaid long-term service funds towards more affordable and accessible group home environments. However, she said this requires better oversight of those facilities, which often struggle to follow state requirements, especially in cases of unlicensed homes.
And if you monitor appropriately and you hold individual facilities accountable who are not providing good enough care, then you can kind of clean up the system. That has not been done, generally speaking. We don't need, really lowball operators to continue being in our systems that are taxpayer financed. We want good quality, mission-driven providers, but we have to insist on it.
Spotlight on Maryland will have more on Tuesday about how states are cracking down on senior facilities and what we can learn from those solutions. For Spotlight on Maryland, I'm Patrick Huff.
I'm Kai Jackson. Thank you for watching. Here's another video to watch. Also, please take a moment to subscribe to our channel.